Reiterates the fight against COVID-19. The health sector remains the pivotal point of this fight. Several adjustments have been made in different sectors, some helpful, some questionable. So today, the number of cases still going up at 15, being the latest recorded in the country in the last 24 hours. But we choose not to relent. Tonight we seek to know what new COVID-19 measures the government has incorporated in our health sector, particularly in the country's biggest health facility, that is Kenyatta National Hospital. And the CEO, Evans Kamuri, is with us tonight. And so we need you to bring us, he will certainly bring us up to speed in regards to what is happening in that sector. And of course, we need you to talk to him or talk to us. So send in those messages, #PledgeWatch at TV47 at Linda_Alela, and of course he will get to answer some of these questions. Welcome on board. My name is Linda Alela, the sign language interpreter, and Wairimu, as we set ourselves for that and much more. Let's first take a look at the highlights of the day. 15 more people test positive for COVID-19, with 3 more succumbing to the virus in Mombasa. And in politics, Elgeyo Marakwet Senator Kipchumba Murkomen chided Senate Speaker Kenneth Lusaka for accepting changes in the leadership of the majority party in Senate. And tonight, we tell you about the selfless community healthcare workers and their arduous task of keeping communities healthy despite the odds. Welcome back, and once again, sign language interpreter and Wairimu. Now, the country has registered 15 new COVID-19 cases in the last 24 hours, raising the number of people infected with COVID-19 to 715. 2 other new cases were recorded from Tanzania nationals at the Hispania border, and 8 more people have recorded, raising the number to have recorded, and of course raising the number to 259, while the number of deaths has increased to 36. And as Lydia Gashomo reports, the government is drawing measures to make sure that police cells conform to COVID-19 containment measures. Let's take a look.
We have tested 978 samples, out of which 15 have tested positive for coronavirus. Of these 15, 14 are Kenyans, and 1 is a Rwandese national.
Instances of suspects cramming in police cells have been reported even during the current coronavirus pandemic. And now, the Health Chief Administrative Secretary, Dr. Rashid Aman, says that the government is putting up measures to curb the spread of coronavirus in cells.
We have provided Prisons Department, wherever they have health facilities, we have provided them with materials, PPEs, sampling material, and they have been equally trained in sampling some of these inmates. Together with the counties, of course, where these prisons are placed, we are collaborating both with the Prisons Department and with the county authorities to be able to monitor and test these prisoners, and then take the necessary measures to ensure that there is no spread in those environments.
In the past 24 hours, Wajir County has recorded 2 new COVID-19 cases, which are highly attributed to its close proximity to Somalia, which has recorded more than 1,000 COVID-19 cases.
In Wajir, the cases are in Gulet Dere, in Wajir South, and Grift to Haga in Wajir West. In Nairobi, the 1 case is from Githurai 44, and in Machakos from Katiani.
Security has been heightened at the Uganda and Tanzania borders so as to reduce the spread of COVID-19.
The security forces are doing the best they can to mend these borders and to control movement there. But, of course, people still use some of these porous borders. So we are now focusing on trying to provide and upscale the level of security at these borders so that we can also block off some of these porous borders.
Globally, there are more than 4.2 million reported COVID-19 cases, 1.5 million people have recovered, and more than 280,000 others have died. Lydia Gashomo, TV47.
And now to some bit of politics. Elgeyo Marakwet Senator Kipchumba Murkomen has hit out at Senate Speaker Kenneth Lusaka, accusing him of acting as a puppet for the president. Murkomen was reacting after the speaker issued a communication on the changes in the leadership of Majority Party in the House, as presented by the new Majority Whip Muranga Senator Irungu Kangata.
The only agenda for our party, Jubilee, has been wrangled from 2018 up to now, not focusing on delivery of services. If the greatest achievement of the President of Kenya is to demonstrate to the people of this country that I have removed my majority leader, I'm a big man. Mr. Speaker, the President is already a big man.
Onesmus Kipchumba Murkomen's political journey started way back in 2013, the time he vied for Elgeyo Marakwet's senatorial seat under the URP ticket, party then led by the Deputy President William Ruto. Under the Jubilee umbrella, Murkomen was appointed Senate Majority Leader in 2017 to represent the ruling coalition party Jubilee, which he did in the early years in the position. Things started to fall apart after the handshake between former Prime Minister Alela Odinga and President Kenyatta on 9th March 2018.
Adui ya umoja wa Kenya ni wale ambao wanatembea nchi hii, wanatembea na mkono mmoja wakipeana salamu na wamebeba kisu kwa mgongo. Unajua mtu akikusalimia namna hii lazima mwambie kwanza, "Bwana, kabla hujanisalimia weka mkono yote mbele." Sasa kuna ule jamaa alikuja akasalimia rais, akasema basi tusalimiane. Lakini anabeba kisu ya mkongo kwa mgongo anataka kupika nayo naibu wa rais. Hiyo ni mtu mzuri kweli?
Rais ati kwa sababu sasa ya handshake Jubilee House. Hata leo gazeti pages karibu 4 inasema kwa sababu ya handshake Jubilee imetetemeka, imewachana, rais na naibu wake hawako pamoja. How?
Tuangalie kazi ambayo tunafanya. Tuache hii mastori tunazungushwa hapa. Hata Murkomen sikujua uko na masaa ya kusoma magazeti buri huko. Tufanye harambe, tufanye mambo yale mengine, tujenge Kenya. Au namna gani?
Murkomen, who is a close ally of the Deputy President William Ruto in many instances, has been seen to be vocal in condemning the way BBI rallies were planned in various counties before the coronavirus pandemic hit the nation and the rallies were stopped.
Kwa hivyo, Mheshimiwa Rais Uhuru angeweza kufanya mimi kuwa majority leader kama nyinyi amngechukua yeye kuwa rais. Na wale wanasema tuheshimu rais na heshimu pia naibu wa rais, heshimu chama chake na uheshimu umoja.
Recently, Nairobi Governor Mike Sonko's 357 million graft case saw Senator Kipchumba Murkomen and Makueni Senator Mutula Kilonzo represent the governor in the anti-corruption court, something that didn't augur well with the president.
Each of us, you and me, must make daily decisions purely driven by Kenya's wider and enduring interests. This, I believe, is not an unreasonable ask or an impossible position.
And then came the stroke that broke the camel's back. Last week, Kipchumba Murkomen, as Senate Majority Leader and on the floor of the House, opposed the national government takeover of key functions from the county government of Nairobi.
It is therefore completely baffling and unfathomable that despite the express requirements of the Constitution, the purported transfer of functions from Nairobi City County Government to the national government was conducted in an entirely opaque manner, with no reference whatsoever to the public gallery generally, and in particular to the people of the Nairobi City County. This is a complete clawback on the principle of public participation that is so dearly held by Kenyans at large.
Further, Senator Murkomen is a close ally of the Deputy President William Ruto, and his role in the 2022 political game plan might have led to the woes he is facing right now. Joash Onsare, TV47 Nairobi.
Well, a bit of a mix-up right there as the two stories touch on Kipchumba Murkomen. That story by Joash Onsari touching on where the rain started beating him. But that aside, I think we pick up the other story first. Elgeyo Marakwet Senator Kipchumba Murkomen has hit out at Senator Speaker Kenneth Lusaka, accusing him of acting as a puppet for the president. Murkomen was reacting after the speaker issued a communication on the changes in the leadership of the majority party in the House, as presented by the majority whip, Muranga Senator Irungu Kangata.
Revolutions eat their own children.
Yes.
Government eats their own people. This government is going to punish you more than they will punish me.
Words of Siaya Senator James Orengo, directed to Jubilee senators 2 years ago. And now, immediate former majority leader in the Senate Kipchumba Murkomen and former majority whip Susan Kihika are experiencing exactly that. Their own party de-whipped them in a rather cantankerous manner. They tried to object the removal, but their fate was sealed.
To 1, remove the current leader of majority, Senator Kipchumba Murkomen, in accordance with Standing Order 19.5. B, remove the current majority whip, Senator Susan Kihika, in accordance with Senate Standing Order 19.5. C, elect Senator Samuel Bogisho as Senate Majority Leader. D, elect Senator Irungu Kangata as Senate Majority Whip.
Murkomen is now turning the heat at the Senate Speaker Kenneth Lusaka, accusing him of being used by the president to make an alleged injustice on bona fide party members.
What was only being defended on this side was the fact that we must follow the rules. Be it as it may, Mr. Speaker, if finally you will disregard the law and make a decision that I'm not going to be the majority leader in this House, what I can only say is that I want to thank my colleagues who voted for me. Mr. Speaker, the president is already a big man. I am just but a son of a squatter, born and brought up in Embobut. To be a subject of his discussion over and over again, I want to say, Mr. President, now therefore deliver for the people of Kenya. Murkomen is out of the way. If I was your stumbling block, deliver for the people of Kenya.
Kericho Senator also faulted the Speaker acceptance of the removal of Murkomen and Kihika from the leadership of the Jubilee in the Senate, stating the move was done in a bad faith.
Because it was non-procedural. How you choose to treat this information, Mr. Speaker, is out there for history to remember that at such a time as this, when the country was faced with such a serious pandemic as we are dealing with, people sat somewhere, made forgeries, and we are about to sanction it as a House. We will go down so badly, Mr. Speaker.
But opposition senators led by minority leaders chided the duo for disrespecting the Speaker's office.
I heard Senator Murkomen state unequivocally that the president should stop lying to the nation and he should now deliver the things he itemized. Mr. Speaker, is it in order for him to run away from his statement?
Elsewhere, the political parties' dispute resolution tribunal has suspended the post-election coalition between KANU and Jubilee until the National Executive Council of the latter approves the merger. Elizabeth Mutuku, TV47 Nairobi.
And still on the same, as Jubilee senators attack at each other in the plenary of the House, their fervor is almost palpable to their bosses in Karen and State House. Jubilee party is almost dead, but also so much alive. The Pandya say its leaders are in a cold war that has far-reaching implications that will leave only one man standing. But who is this? Andrin Kilimi reports.
The only agenda for our party, Jubilee, has been wrangled from 2018 up to now, not focusing on delivery of services. If the greatest achievement of the President of Kenya is to demonstrate to the people of this country that I have removed my majority leader, I'm a big man. Mr. Speaker, the President is already a big man.
Division within the Jubilee party is now more visible than ever. Monday's ouster of Senate Majority Leader Kipchumba Murkomen and the Chief Whip Susan Kihika being the latest crack in an already weak coalition. But according to communications consultant Barak Muluka, the reality of events in the political field will eventually change.
What one can say safely now is that Ruto and President Uhuru Kenyatta have fallen out, and they appear to be on the last stretch of their falling out. Whether the troops around Uhuru Kenyatta will stick with him, or whether they will migrate to find a formation around another leader, whether that leader will be Ruto or whosoever else, we cannot tell. It is far too soon, and politics are very much predicated against the exigencies of the time. So we don't know what the realities going ahead are going to be. We can only say safely that those two are no longer together.
According to Muluka, who spoke to TV47 on phone, top leaders in the Jubilee Party have weakened the party, and this might lead to lack of total trust within the system of the party's politics.
What we are seeing is the falling apart, the crumbling and falling apart of the Jubilee Party. Possibly, Deputy President William Ruto will find another formation. I don't know whether he will want to call it Jubilee or Jubilee something. President Kenyatta will go in another direction with his own strand. I don't know whether he's going to call it Jubilee. But the most critical thing that we can say about this without any fear of doubt or contradiction is that in future it is going to be very difficult for people in politics to trust each other. Certainly, President Uhuru Kenyatta is going to suffer a very serious trust deficit.
Pandits also opine that President Kenyatta is likely to suffer a very big drawback in the process of pursuing political legacy. Hence, there may be creation of another political party ahead of 2022 general elections. Nonetheless, the quagmire in Jubilee is the perfect definition of dirty politics. Leaders acting for the whims of their political patrons, no matter the dictates of their political party's charter. The row smacks of betrayal and backstabbing on the part of Deputy President and his ilk, and the same can be said for President Uhuru Kenyatta. It's now not a matter of who is betraying who, but who will outsmart who in this game of weights. Linda Alela, TV47. And they work tirelessly in the community, almost unnoticed. In some communities, the community healthcare workers are the only health caregivers available for hundreds of people. But even with the humongous work they have to do, many go for months without pay. And now many do not have the personal protective gear to guard against the highly contagious coronavirus. Here is Daniel Dembeda with a story on suing health heroes. Or unsung health
providers, community and patients in the country all benefit when community healthcare workers build bridges that lead to better healthcare, better lives and reduce the cost of healthcare in the country. It is at this point these community health workers, or rather CHWs in Kisumu County, popularly known as Nyamrerwa, have volunteered to spearhead better healthcare, create awareness in rural communities and vulnerable people on communicable diseases. We meet Morina Cheng in the morning hours at her home in Nyalenda B slums. At 35 years of age, she is an energetic woman and she is ready to go meet her many clients. She tells us that she normally communicates with her clients via phone, but to those who lack mobile phones, she is always forced to move physically to their households.
Saa tatu kuna clients wangu wengine naweza kuwapigia simu wenye wako nayo. Tuna communicate through simu. Kama kuna umuhimu zaidi ninafika mahali wako, na kuna wengine wana simu, lazima nitembee kwa mguu mpaka mahali wako.
Maureen covers a total of 180 households, translating to a population of more than 1,200 people per month.
Mimi nina cover household 180, total population ni 1,246.
Edward Mito Milambo is another CHW who has been in the field for the last 27 years. His passion towards his work has made him keep on moving and serving his community, making him trusted worker by his patients and health officers.
Hii kazi ilianza kitambo kidogo, mimi nilikuwa mskauti. Hii kitu imestick ni kama ni a call kwa maishani yangu.
Both Maureen and Edward confirm that in their line of duty, things have not been easy. They are forced to dig deeper in their pockets to get facilitation to move around. Further, they say that they lack personal protective gears when interacting with clients, especially during this coronavirus pandemic period.
Kuenda kwa mgonjwa, sina pesa, sina hela, nitatembea.
Sisi kama CHV wa Kisumu County hatujakuwa kwa payroll for so long. Hadi hivi majuzi last year vile UHC ilikuja, UHC ndio ilianza kutulipa shilingi 3,000 na wanakata 500 inaenda kwa NHIF. Na sofa hiyo pesa hatujapewa kwa miezi 8 hadi wa leo.
Na hii mambo ya COVID-19, mtu lazima kwae kwa nyumba. Sasa hii tunapata very big challenge. Tunakaa kwa nyumba.
Despite being volunteers in the community, still some leaders keep them at bay.
With the community there's no problem. Shida iko tu kwa county government na government, national government.
Serikali so far naweza kusema imetutupa kiasi.
On the other hand, clients of community health workers have applauded their efforts.
Watuongezewe nyamrarwa zingine ili watusaidie.
Na muhimu sababu anatusaidia. Hata ukitaka dawa unaweza muende umuulize hivi na hivi kusaidia.
Community health work alikuwa ananitembelea, ananisaidia, ananipea mafunzo, ananiambia mtoto nanyonyesha paka 6 weeks ndio nampatia chochote, maziwa kaa uji hivyo. Naona kama amenisaidia sana.
Kisumu Governor Professor Peter Nyang' Nyong'o has said that currently the county has 2,558 CHWs and the optimum number is expected to be at least 5,000.
But at the moment we have 2,558 community health workers in Kisumu County. Optimally, we really need about 5,500.
The governor says that the county has come up with a plan to ensure every CHW receive his or her own salary. Professor Nyong'o regrets that there have been instances where mismanagement of funds belonging to the CHWs has led to delay their pay.
We cannot have more CHWs than Kakamega. Kakamega have 12 constituencies, we only have 7. So there's no way that we can have more CHWs than Kakamega. There must be something wrong somewhere. So we agreed here that I want to pay them quarterly. The money is now there in the budget. We are going to pay in arrears those months that have not been paid. And we agreed we are going to pay them in arrears, which is going to be a bonanza for them.
Daniel Dembede, TV47, Kisumu County.
Nice piece right there by Daniel Debede. Now let's cross over and we come back to Nairobi. Residents of Dandora and Baraka Estate are forced to buy a 20-litre jerrycan of water at a cost of 10 shillings. According to Rebecca Nyamoge, a resident of the area, they are forced to walk a distance of 5 kilometers in search of water. On the other hand, residents of Kariobangi North who have been living in tents after their houses were demolished will be forced to seek other alternatives since the Nairobi Water and Sewerage Company has started erecting fences in the area.
Residents of Dandora and Baraka Estate in Nairobi have been without water supply for weeks now. The irony is that 29 counties have been affected by floods due to the ongoing rains since March this year. And on the street, young men pulling carts loaded with jerrycans of water is now the new normal here. According to one Rebecca Nyamboke, a resident of Dandora, they have no option but to buy salty water for domestic consumption.
Nimepotea wiki mbili sasa, tunabai maji. Maji ni shida, inakuja let's say mara moja kwa wiki na inakuja tu masaa then inaenda. So tunakubai maji, tunatembea na hata hiyo maji tunabai si poa, ni ya chumvi.
Stephen Minor, a water vendor within Baraka Estate, says they sell a 20-litre water jerrycan at a cost of between 30 and 100 shilling.
Maji kulingana na vile huko. Wewe tukikuangalia hivi wewe ni mtu wa kulia, tunakuchapa salasa. Wewe tukiona wewe ni dong hivi, tunakuchapa 80, chwani 40, yeah.
Elsewhere, evictees of Kariobangi North Estate are calling upon the government to provide them with food items. The evictees are living in squalid situation with as many as 8 people cramming under one tent.
Tunangojea vile tunaweza saidiwa juu hata pesa hatuna. Hata kukula tunakula na kubahatisha. Hata wajukuu tujui wako wapi kuanzia hiyo siku kulibomolewa.
Zablon Masharia, TV47, Nairobi.
And we now take a short break, but remember I'll be speaking to KNH CEO on the other side of the break, so don't you go anywhere. Remember, it's important that you interact with us. #PledgeWatch. We get to hear what questions you have for him, and he'll certainly get to answer that after this break.
Mount Kenya University takes pride in being an academic giant with some of the best infrastructure, imparting knowledge to the best brains in the country and the region. Our members of faculty are keen to deliver market-driven programs in science and humanities with a keen focus on linkages with relevant organizations. We admit both self-sponsored and government-sponsored students under the Kenya Universities and Colleges Central Placement Service. Join us today and train with the best to become the best. Mount Kenya University, unlocking infinite possibilities.
For more inquiries, please email ads@tv47.co.ke or simply call us on 0748 205 604.
Back. My name is Linda Alela and this is Pledge Watch on TV47. Now, Kenyatta National Hospital was built to fulfill the role of being a national referral and a teaching hospital, as well as to provide medical research. Established in 1901 with a bed capacity of 40, over years now, KNH has grown in leaps and bounds, and with its fair share of floats, today it is East and Central Africa's biggest referral hospital. What can be attributed to this growth, and how is the facility contributing to the growth of the health sector in Kenya? Tonight, the CEO of Kenyatta National Hospital, Evanson Kamuri, joins us to expound much more, and most importantly, we get to know what it is that the facility is doing towards ensuring that it contributes to the fight against COVID-19. Welcome aboard. Thank you so much for finding a time, sir.
Thank you.
Yes, and we go straight to it. Out of the 34 CEOs that have served the hospital for the longest of time, only 3 left in clear circumstances. What does it make you feel to be the CEO of Kenyatta?
Well, it's a dynamic job.
Right.
It is it's unpredictable, and sometimes we are judged harshly by the society.
Right.
Sometimes you carry a burden, as usual. When you are the team leader,
right,
all the soldiers are behind you. So if one soldier messes backward or behind you, then you carry the burden. And most of the time that has been the case. However, it's a job, it's a service to the mankind, and somebody has to do it. And that's why we are doing it.
All right, it's taking us back to the times of Lily Kweros and Dr. John Ongech, who at some point in time was, appointed to take over, after that suspension of Lily Koros, but certainly said that, no, I will not take up this challenge simply because, I mean, it's a cartel-driven entity. Do you suppose this is the case? Or one would argue, have you been instilled by the cartels?
Well, I wouldn't say that it's a cartel business, and I've come to learn people talk what they know, people talk what they don't know. And more often than not, when you don't know something, then everybody knows something about it. We've been asking, where are these cartels?
But he's been at the top of the helm, you know, he understands the activities in Kenyatta National Hospital, being a doctor.
I'll tell you now, and I will tell you without fear of contradiction, that the government that we are running now, we run with guidelines, we run with the acts of parliament, we run with the laid down rules and regulations. Most of the procurement, for example, are governed by Procurement and Disposal Act and the PFMA, something called the PFMA. And you cannot work beyond that. And if somebody, and I've been telling people, if you want me to work beyond that, don't waste your time. I work within a guideline, and that's what we will do. If it is a tender you want, please come and advertise. We advertise tenders like any other person. We advertise jobs like any other person. If you want to participate, and Kenyatta is a public entity, and it's open. We use open system, apply like any other person. I will tell you, even now, I'm the CEO, but I'm still also a clinician. I'm still doing my clinical work. So anybody who wants, don't come waste my time that you want me to do you favors. Participate like any other Kenyan, and we will have a fair play without trying to find how you can alter the systems. We have tried to put all the systems now in place, and we can tell you that most of the things are done overboard. You've seen even now the board is participating, and the ministry, we are also having a very close link with the ministry and even with the county. So there is nothing we are doing in isolation as Kenyatta National Hospital.
All right. Okay, we'll delve deep into that as we proceed. But most importantly, we get to ask this question. Mid COVID-19, you know, the crisis in the country, there was that declaration or that order by the government or the Ministry of Health that, you know, a bit we adjust in terms of, you know, the health sector, the facilities across the country. Would want to know whether there was that adjustment in Kenyatta National Hospital and what the impact has been so far.
Adjustment of what?
Adjustment in terms, you know, of the services that are being offered right there. At some point in time yesterday, we received reports that yes, now Kenyatta National Hospital is fully functional, contrary to what has been since that time that, of course, COVID-19 hit the country. And this was communicated by a senior official within.
Well, first, information travel in different circumstances. But if you had followed backward when the chairman, the then chairman, Engineer Nicholas Ngumbo, he said very clearly that we did not stop the services in Kenyatta, and we cannot be able to stop services in Kenyatta, with or without Corona. Even the time of when there was fear of Ebola, we did not stop because Kenyatta cannot stop even one day. We cannot even close. And if you have noted, even when there is industrial dispute among workers, we still have to continue with functions in Kenyatta. Why? Because Kenyatta plays a major role, and most of the cases that we deal with are not cases to be handled by any other person. We are a specialized hospital. We deal with acute and severe emergencies. I don't know whether there is something called severe emergencies. We deal with life-threatening cases. So that, and that tells you that we cannot close. Like now, with or without COVID, people are still getting accidents. Where are they going? With or without COVID, people are still getting hypertensive strokes. People are still getting blocked arteries, and somebody has to open them up. People are still getting appendix. What we are saying, women are still delivering. People are still getting complications of delivery, and we cannot stop that even with or without COVID. So what we did, and we have also, other than those critical cases, there are those patients we call routine patients. They are those patients we run outpatient clinics, medical outpatient, surgical outpatient. For example, maybe we operated on you last year and we have to follow you up, and we do routine follow-ups, either monthly, 2 monthly, or something like that. Those are the ones we told them, because you are stable, we can actually have a mechanism of following you up to make sure that you are okay, so that you also don't come and increase the traffic, which will expose you more. There are also some patients who have some immune problems. For example, there are patients who are diabetic, there are patients who have HIV, who are on treatment, there are patients who have TB. We would wish that we actually organized and made a system so that we can actually follow them up, so that they can still get the service without coming and increasing the traffic. But there are others we did not stop. For example, cancer. And I've been hearing people saying we have stopped cancers. And if you listened in the morning, I said, what we even did, now that the numbers reduced for obvious reasons. One, fear. People fear coming to the hospital, and also they also respected the order that please let's avoid unnecessary movement. And then there is the blockage. There is the movement that was stopped from entering Nairobi. That automatically brought the numbers down. However, we took advantage of this time. And most of the pending cases, we had pending cases of, for example, cancers of the breasts who are waiting for surgery. We had people who had cancer of the esophagus who are waiting to be put stents so that they can be able to eat. Those were a number of patients. We have done something called an RRI, so that we can actually reduce now those pending cases who are many, and we could not keep up with the numbers. Even and from next week also, we are now doing another RRI for orthopedics. Our orthopedic wards have been very congested because all these accidents, that's where they go. Now we are actually doing another RRI. What I mean is RRI means Rapid Response Initiative, so that we open a number of theaters, we start doing most of operations on those specific areas, so that we can also now take advantage that the wards are not crowded. We now operate on those cases while the numbers are still down. Of course, our numbers have come down for one, as I've said, but what I'm trying to say is that we are still giving the services. We have even gone ahead and opened a WhatsApp system, SMS system, and we are even piloting what we call telemedicine system, where now some of the people who are in the diaspora, Kiambu, Muranga, Nyeri, and they have been our patients, we are actually connecting them so that we can actually try to give them service remotely. We can service them remotely. What else also we have done, and we thank the government that we were given Odaya. There is Odaya level 6. Now it's called KNH Odaya. Most of the patients who are from that side, we are also directing them there. They don't have to come to Nairobi. It is easier for us to send specialists there. So we are sending doctors there. We also have consultants there, but we are also sending a number of specialists there to attend to those people in Odaya. That is still our branch in Odaya. So all these have actually helped so that we can continue making sure Kenyans get value for being Kenyans.
All right. In a bid to tame COVID-19 again, these patients who walk into hospital, there's that declaration by the government that, one, they should be tested. So supposing I walk into, of course, Kenyatta National Hospital today, or the facility today, what will be the testing cost in the facility, or it is as free as maybe has been declared by the government as well?
Well, one thing I want to still clarify, and Waziri clarified there, we are doing something called targeted testing.
Testing, yes.
Targeted testing means the epicenters, the places that we are recording many cases, we are actually going to do mass community testing.
Contrary to that, sir, there was also that declaration that when you are going to hospital to seek medical advice, or medical services, then it means you need to be tested first before, of course, you get services in regards to what has taken you there.
We are going to do that, but at the moment, what we are doing, for example, in Kenyatta National Hospital, when you come for other problem, we do something called triaging. Triaging means we first eliminate whether you have tendency, could you be one of the culprits that could be having COVID? Because as you know also, the process of testing is an expensive affair.
Yes.
And you heard the Waziri saying, actually, the actual cost of testing COVID would be something close to 10,000, between 8,000 and 10,000. However, it has been significantly complemented such that even what we are charging now for hoteliers and such, it is grossly discounted. However, for patients, we are actually doing it for free, courtesy of the Ministry of Health, because the Ministry of Health is providing the kits, we are providing the human resource and the process, and also the Ministry of Health is also providing those lab personnel so that the tests can be done.
All right.
So this has really been discounted, and it is good that people know that most of the people who have come to the hospital, most of the people who have actually had corona per se, the ones we have tested, and I can tell you, you can challenge, all the people who have been seen in Kenyatta, we have not charged them because the Ministry of Health has been taking care of that. That is for the sick patients.
Right. So, of course, approximately how much would a person who's working in, probably is supposed to, work in a restaurant, be charged at this stand as we speak? The other time I was at Bagavi, and, there was still some hitches on how this is going to be charged. So far, do we find a clear answers to that?
So far, there is we rely, as I told you, Kenyatta National Hospital works under the Ministry of Health, and we work under the umbrella of the Ministry of Health. Once a decree is done by the Ministry of Health that will be charging 1,000, for example, for the hotel workers, for us, we have no choice. We are relying on to that, because by the time the Waziri is saying 1,000, it means he has put measures in place so that the cost is somebody else is taking care of that cost. And the Minister of Health is, and as you heard Waziri Barala saying yesterday, they have had a discussion, and because of these are extraordinary times, it calls for extraordinary measures. So the government is actually putting those extraordinary measures so that it can buffer or it can cushion most of these people from hotel industries.
All right. Okay. Today is International Nurses Day. We congratulate and celebrate them for the exemplary work that they have done.
World of M-Truck Solutions, your trusted provider for bulk SMSs. We also offer API integrations for all your communication and payment needs. We also provide you with tailor-made payment gateway solution to receive and disburse cash quickly, affordable and securely. Let us expand your reach and connectivity on USSD, SMS and voice today. Call us on 0723 030 030 or email hello@mtruck.limited.co.ke. For more details, visit our website www.mtrucklimited.co.ke.
Hey, Sospita son, tumefutwa wote.
Hey yawa, pia wewe?
Tumeachiliwa.
Si pia wewe unaweza anzisha biashara yako?
Na hii economy venye iko tough sana.
But not too tough for Mwananchi Credit.
Tutafanya aje?
Si niko na 5 good cars. We can get a quick logbook loan approved within 6 hours.
Nataka kuanzisha salon na spa. Hii haitatosa.
Si tuko na title deed spare. We can still get more money using them. Get a quick approval within 6 hours using your logbook or title deed. Do not get stuck. Call Mwananchi Credit today. Si nilikwambia.
You are a big smart joke.
Mwananchi Credit. Investor in people.
This May on TV47, we are giving you more reason to stay at home.
You are the chosen one.
Because I am your mother.
Oh, that's pretty cool.
same-sex attraction isn't completely gone because
my root is from God.
No, Pete. Lazima around you utalipa. You'll see some kind of like a smokish thing.
Hey man, don't forget about the monkeys.
Mama Saida, see you.
Where
are we?
Right here on TV 47, the home of untold stories.
And Dr. Kamuri, it is International Nurses Day. We celebrate them, of course, for the exemplary work that they have done. It is cuts across, all the frontline workers. So we'd want to know, what protective measures have you put on board, to ensure that the healthcare workers are well catered for, even as we speak right now?
As I was saying, first I want to congratulate my nurses, and I say I love you all. And as I said, I have worked in many parts of the world, and I'm yet to find nurses who are as hardworking as the ones I have in Kenyatta. Wow. Of course, they are the majority, and but they work with their blood, they work with their hearts, and I would also urge the public to support them and embrace them, and also support the work they are doing, because 90% of the services they offer is actually from inside their hearts. Mm-hmm. And the earlier we get that, the more we will understand them. Yeah. As a hospital, we embrace them. And two, as a hospital, they are also given the necessary training. We do capacity building for them. We do career development for them. We are one of the institutions that really respect career development of healthcare workers, from the nurses and even other cadres. And also, we have also taken care of in terms of protection, the protective gears. Yes. We have given them masks. We have given them the areas that need coveralls. We have given coveralls, and we are even going ahead now. We are, with this COVID era, we are also now starting to give them scrubs so that they can be leaving their clothes at home. At this moment in time, we have also organized, after the shift, we are transporting them home so that there is no inconveniences in getting to their loved ones in good time. All this is making sure that they are comfortable. And we are, not to forget, we are still paying the salary as it should. Mm-hmm. Yeah.
Okay, speaking of which, brings us to the point of money. And lots of allegation in regards to what has been happening in Kenyatta National Hospital, to a point whereby it's been pointed fingers at, with the aspect of saying that, is it a money-meeting entity, based on the cases that we have witnessed down there. I mean, what would you say of this allegation? I mean, does it hold water in any way?
The first thing I want to tell Kenyans, we are not paid. Kenyatta National Hospital, there is no staff who is paid by the number of patients they see, right, or by the number or the complexity of the case. In fact, and I want to challenge, other than the people in finance, most of the people who work in that hospital, if you ask them how much do you charge a consultation, how much is a bed, they may not know. Because for us, money is not an issue. Most of the services we render in Kenyatta are grossly subsidized. Actually, if you look at even the types of operations we do and how much we pay, we don't even break even. Why? Because these are government organization, these are government infrastructure, and most of us are actually government workers, which I actually refute when people say that people come at, you will not be given services unless you pay. I want, and I say, you who is paying, come to me and show me that person who is asking for you money so that you can be fast-tracked or you can be seen. Such things shall not happen. The system we have, and in fact, if you must know, and anybody who is listening, Kenyatta, we run a cashless. We run a cashless system. So if somebody is asking you for money, just know that is not even a Kenyatta worker. We don't see people because, and we also have no respect of a persona. Everybody for us is a patient.
Well, this could be obvious, sir. This could be an obvious question. I mean, what then brings in the difference between those ones that are in the private wing and, you know, the other ones?
You see, those are two things. And these are, again, two things I want to clarify very clearly. Right. Kenyatta also has a private wing. We call it a prime care service. That is totally different from actually the normal hospital. Okay. This is a private wing like any other private facility in Kenya. It is on 10th floor, and they even run, this facility has actually no link with the common hospital. It actually runs a parallel. This was created so that we try to bridge the gap, so that some of the proceedings that actually are earned there, they are actually trickled down to improve services in the rest of the hospital. And why did we start this? Right. There are people who can still afford more. In the society, as you know, we are equal, but some people will also offer more effort in doing something else. There are people who still wanted Kenyatta services, but they would want to pay more. Those people who want to pay more, that's why we created only level 9 and level 10, so that bridge, the proceedings that we get from 10th floor, we use it normally to improve further the facilities in the other levels.
On the other hand, there are people who would want to use the Kenyatta National Hospital facilities but are forced to pay for more when they are referred to, you know, say Doctors Plaza, they are referred to private entities that again are run by the very same doctors within. What would you say about that?
Again, Doctors Plaza is also an entity. There is no facility. Even Nairobi Hospital has a Doctors Plaza. Even Mata Hospital has a Doctors Plaza.
What
even
about being sent to private entities?
All those hospital infrastructure have a Doctors Plaza. Right. The reason why we created a Doctors Plaza, when doctors work, for example, when they finish their work, yes, we created that so that we could also try to keep them within the environment, such that in the event there is an emergency, we don't have to crisscross from because we will still not stop them from going to do their moonlighting anywhere. And this is something that was started long time ago, the 90s. It's only that it has peaked with the time. And we actually started it so that when they are around there, in the event that you have to do something in the ward, you are called, there is an emergency, you just cross in and you close out. Yeah.
All right. Let me refer to this, and they say about 10,000 Kenyans seek medical treatment abroad, spending over 10 billion. And sometimes these healthcare services are available right here in the country. Do you suppose that Kenyans are well informed of the services available in the country for them?
Well, again, knowledge is self-driven. Information is also self-driven. You have to seek the information. But the other thing is choice. Normally, prophets, there is a saying that prophets are not known at home. As much as we tell people, like now I will tell you, very few people do as many renal or kidney transplant like us. And in fact, even now is the time we are trying to do liver transplant. You've seen the complicated operations we've done. We separated the twins the other day. We joined hands. Some of the operations that we do cannot be done anywhere else in the world. And in fact, when we record, everybody wonder, how can you be the ones who are doing it? It's only that we need some level of education. And who will educate the people? Right. The people to educate is first, we start with the fourth estate. Unless people listen to you. So the stories that you give, if you can give the story, you can give the same weight about people going to India. If you can give the same weight about how many kidney transplants we are doing and how much we are charging, then people will know. And in fact, what I would want to tell Kenyans also, please note that most of these people who go to India, eventually they still come back to us. Because even when you are transplanted, when you do an organ transplant, it doesn't end there. If you are given a kidney, we have to follow you the rest of your life. Most of them, they are still with us. And what we are trying to urge Kenyans, and I will challenge any Kenyan who would wish to come. We have opened Kenyatta. We are running an open system. Please come in and visit. See the facilities that we can offer. Right now, we have even expanded. We have expanded the facility for kidney transplant. Most likely, we'll now be doing maybe 4 or 5 kidney transplants per week. Please come and see. We have opened the sector of cardiac catheterization, where we can actually operate you without opening you up, what we call invasive operations. Right now, facts be told, there is nobody who does as many radiotherapy as Kenyatta. And we thank God and we thank the ministry that they have been supportive.
Dr. Expansion comes along with communication, proper communication, that it gets to the people that it is intended to help. So what are you doing as an entity also to ensure that, as much as maybe the public is not aware, is not proactive enough to get to know this, I mean, this information gets to them?
What we are doing is like what I'm doing now.
Yes.
How you came to make me talk to you, that's what I'm doing. Okay. 2, we have engaged now a vibrant young communication and marketing manager who will also be giving these stories. But the other thing I want, you see, we need you people to come also and find stories. Most of the time, how do you find stories of people, an accident? You actually go to harvest stories. We would want people, we are not closing the hospital. We want people to come and see what happens in the hospital. I like some of the journalists who actually come and follow a procedure of how an operation from the beginning to an end. The other day you saw us operating a gentleman without a very huge person. And we remove the stomach so that he can become thinner without doing all these exercises. These are operations that make people go abroad.
Is it as open for journalists to do that? Because sometimes the procedures before you get this, a go ahead or nod to proceed and come and film some of these things is quite hectic.
What I've told you, if you are, I don't know how much Bible you know.
Yeah.
The Ark of the Covenant, the Ark of the Covenant, the piece of cloth when Jesus died, it opened. It means people could see what is inside. There are a number of things that the medical field has opened, including husbands now enter the delivery room to see the wife delivering. The same thing, we have allowed some of these things. We have allowed journalists to come and see, especially when the confidentiality of the patient is not infringed. We have allowed people to come and give Kenyans the stories. Some of these things that you believe it is like miracle, we want you to see. And also we want people to appreciate how much these health personnel do, so that when you see that somebody is tired, you can understand actually what is actually making them real tired. And you can also find how much dedication they have when they are serving you.
Okay, 2 key questions before we get to wind up, Dr. And one would be, lots of mishaps have not been addressed, in regards to how Kenyatta National Hospital has been conducted, lots of issues and terrible reports bedeviling it. I mean, so far, what are the plans that have been put in store towards ensuring that at least this entity is able to restore sanity, taking us back to the times that were, where we have patient sexual harassment, allegations, we've had stealing of babies, negligence, security aspects. I mean, lots of issues.
Well, I will tell you again, let's look at it the other way around. Who is communicating the message? Who is the complainant? We have always been alleged to have. For example, when the issue that we alleged that we are raping people, the people who, how did the story die? Because we came and asked them, look at the CCTV. These are the ladies when they were moving from the nursery. This is where they were breastfeeding the babies. This is the ward. Show us where they were raped.
But equally, at some point, a man stabbed around 40-something times while in the facility.
Again, I am telling you, these are like what people must understand. Kenyatta National Hospital is within the society. What is out there is also what is inside there. The same Kenyans who are outside in the streets are the same ones we are treating. So you will find a thief within that. Like now, I'll tell you, at any given time, visiting hours, every lunchtime, we see 20,000 people coming in.
Yeah.
So you expect within that 20,000, that's a whole constituency. You will expect there is a thief, there is a mad person, there is a murderer within. So when in a society such one case happens, we should always ask, what is it that could have happened? And then the allegations, when you say that such a thing happened, please always look forward and find yourself, find the story, the real truth before you can. And of course, bad news is good news. Good news is never news. Right. So, and that's why you will see what moves like a forest fire is actually the things that has sweetness, has salt, the story that has salt, but the real truth never moves. And once the truths come out, the story dies. So we would wish people, people always, before you even say something, make sure and double cross it that for sure this is facts that you are saying before you bring things to the public.
All right, Kenyans are convinced tonight that they are safe anytime that they march into, Kenyatta National Hospital in search for, healthcare.
What I can assure you, and I will tell you, when you come to Kenyatta, trust me, you are safe. I will tell you, even me, myself, Kamuri here, if you go to my car, I've put a sticker, in the event of an accident, take me to Kenyatta. Because that is only place where nobody will first ask whether you have an insurance, whether you have NHIF, whether you are from where, whether you have money. We first look at life first. And that's why I said, for us, money, we don't, even when you come there, we will not first ask you whether you have money. For us, it's first to make sure you live. And I said the other time, the first few minutes of an accident are very important. So when you come, for us, you are safe. That was all I can tell Kenyans.
Okay, now Kenya is one of Africa's top beneficiaries of cross-border travel for medical purposes. Is this attributed to private or public healthcare? And what are you doing as Kenyatta National Hospital, one, to ensure that you get the benefits of this? And what can we as well do as a country to ensure that we equally leverage on this?
Well, what I will tell people, for us, we are trying to modify the services so that we give value for your money.
Right.
We want, and that's why part of the thing we even did the private wing is so that we can tap these people who are moving. We can actually get the services rendered here. Right. We have also improved the insurance system so that actually the people who have insurances out there can also benefit from the same subspecialties that we are offering. And then, as I've said, we have opened. Once you get a genuine referral and we think Kenyatta is the one that can give you the services, trust me, you are better in those hands than anywhere else.
All right, still so much to discuss in regards to Kenyatta National Hospital, but we say thank you so much for finding time to be here with us, Dr. Evanson Kamuri, the CEO of Kenyatta National Hospital. Still so much, like I said, but then this particular evening we're going to wind it up at that. It was great having you, and you can look forward to the next show, that is Tuesday. Take a look at, of course, who's going to be coming next in regards to matters politics this time around. As we said, Pledge Watch is all about putting to task the leadership, whether appointed or, of course, based on the aspect of being elected. It was great having you. My name is Linda Alela. Thank you so much once again for your company right from the time we started up until now. Sign language interpreter Anne Wairimu. See you again next week.
World of M-Truck Solutions, your trusted provider for bulk SMSs. We also offer API integrations for all your